Hey, what's up, everybody? It's your boy Montoya Smith, aka Black Socrates. Wanted to give y'all an update on the vaccine. Been wanting to do it. Been doing some research. I'm gonna do some invites real quick. Get my invites out, then I'm gonna holler at y'all, man. Yeah, do some invites, then I'm gonna holler at y'all. Y'all ready for the Super Bowl? Who y'all got? While I'm doing my invites. Let's see here. Get my invites out. Get my invites out. Alright, I'm gonna do 10 more, then I'm gonna holler at y'all. Let's see here. Let's see here. 2, 3, 4, 5, 6, 7, 8, 9, 10. Alright, there we go. Alright, y'all. See if anybody get up in here. See if anybody get up in here. Well, ain't nobody up in here, so let me do some more invites. See if anybody get up in here. It's COVID-19. What y'all doing on a Saturday night during COVID-19? Let me do some more invites and I'll be ready. I'm gonna do, let me see, let's do 5 more invites. Alright, let's go. 1, 2, 3, 4, 5. How about that? Alright, there we go. Alright. So I ain't gonna keep y'all waiting too long. I'm gonna put this up on YouTube as well, but I just wanted to provide a little update. Some of y'all may know I'm in the Novavax Vaccine Trial. So Moderna and Pfizer has been approved. Those are the ones that are being given out via emergency use. They've been approved for emergency use, and those are the ones that people are volunteering now. And so, and I told people I would kind of keep people updated on my personal trial. Excuse me, I had my second shot last week. Only side effect I had was very fatigued after the first shot. The second shot, which I know with the Pfizer and Moderna, I heard people were having more side effects with the second shot. In this situation, I had heavy fatigue on the first, with the first shot. The second one, I didn't even get sore. So the first one I was sore on the arm, very fatigued, had to go rest real early that night. But the second one, again, this is just providing an update on my personal Novavax Vaccine Trial, which I volunteered for. But more importantly than my own trial, I just wanted to give people some more information of how this thing is played out. And so, obviously there's a lot of vaccine hesitancy within our community, rightfully so, because of history. Not going to go too in depth on that part. I've been doing a series of videos on that. You can go look at some of the other videos. We actually did a Zoom event where we brought on an immunization doctor to kind of give as many facts as we could about the vaccine. But I wanted to just kind of highlight how some things are playing out, which I think are unfortunate, because this was unfortunately anticipated. And so there's a brother by the name of Ivory Tosin. I invited him on here. I don't know if he came on or not, but I posted it on my Facebook page. And as a matter of fact, I should have pulled it up so I could read his exact wording or whatever. But one of the things that was a big concern with the rollout of the vaccine would be African Americans' access to the vaccine. And Ivory Tosin is just posted, which I see it, and it's backed up by a lot of information, that a lot of the vaccines have not been delivered. For example, here in Atlanta, where I live, Grady didn't receive any dosages. They were supposed to, but they haven't received it yet. And so the reason I'm pointing this out is because if you think about even just a month and a half ago, all the hype with when the, in a sense, after the Moderna and the Pfizer vaccines had, in a sense, passed their trials and got approved for emergency usage. Remember, there was all the images of like the sister that got her vaccine and or whatever, and so everybody was like, "Look, they're trying to push. Look how they're pushing African Americans, in a sense, to get the vaccine." I did a video at the time explaining that the head of the AMA, which is the first time ever there's a black woman that's heading up the American Medical Association. I forget her name right now. I said her name at the time, but because I said at the time, because she was very aware of the vaccine hesitancy within the African American community, she was real adamant about running a campaign to try to, in a sense, help our community overcome our fears, because she, being African American, absolutely recognized with the history, the medical history we had in this country, why our community would be fearful of the vaccines. And so, yeah, we're live, James. And so she understood why we, naturally why we would, whatever. And so basically they kind of put together a campaign. And so that's why you saw a lot of the initial people getting the vaccine or whatever appear to be African Americans. The reality is we were not first to get it or whatever. And what's happening now was part of the fear. I don't know if you're still on watching or whatever, but I know you and I, Isna, were going back and forth about what was happening with, in a sense, Bill Gates and his wife and the Bill Gates Foundation or whatever. And I know, again, I don't know if you're still watching, but I know a good friend of mine, we have good debates about the vaccines or whatever. I'm an advocate for it. Obviously, I'm in the trial, and she naturally has concerns. Again, very valid reasons for our community to be fearful because of the history. But I just know when we're talking about the Bill Gates and his wife, in a sense, saying that they would like to see African Americans, quote unquote, somewhat in line to get it from an equitable standpoint. Unfortunately, that's what we're seeing play out right now. Ivory Tosin, professor over at Harvard, at Howard University, he was highlighting that was going to be a big concern, that the people that, in a sense, that could afford it or had proper health care, they would actually get in line first with this vaccine. And right now, with the rollout not being very well done, and a big part of it, it's not that it's necessarily trying to keep it away from our community. Let me just try to make things very clear. As much money that was put up for the trials and the money that was put up for the production, I'm now looking into the research, and there wasn't a lot of money put up for the distribution. So it's not going well really anywhere, but it's unfortunate. For example, here in Georgia, where this is, let me see if I got the information here, but there was, let me see if I can find this little note, but it was breaking down like which hospitals had gotten it. They were supposed to get some, and like, for example, for those in the Atlanta area that know about Grady, is a hospital here in the Atlanta area that's very vital, in a sense, to the south side and west side of Atlanta, where a lot of us are. They got no dosages. And so what Ivory Tosin was pointing out was, for all of the fears that we have with the history, his biggest concern, which is within the medical field, where we typically, unfortunately, are not serviced in the way that we need to be, his biggest concern was that the hesitancy that we had as far as not wanting to take it, his biggest concern was, would we have fair access? And he's saying, I'm obviously pointing out what I know about here in Atlanta, but Ivory Tosin is pointing out nationwide that there's huge concern with us not getting the access. And what he simply, and I'm trying to paraphrase a lot of what he was saying, and it's on the Middle Dollar Out Facebook page if you want to go look for his exact wording. But he said, once again, this is the medical field, in a sense, not in a sense ensuring that we have equal access, knowing that unfortunately we have been hit the hardest by the coronavirus as far as deaths and quality of life for those who have, in a sense, have not recovered because about 20% of people walk away, even though 99% live, if you will. So, the mortality rate is under 1%, whatever. So even though 99% in a sense recover, about 20% will walk away with lower quality of life. I definitely Looking gravely, bro. Yeah, I know I need to shave and everything. But anyway, I just wanted to point out that that's been the unfortunate reality that right now, for all of the fears that came out when they was being promoted, like, why are they promoting black people getting it? The reality is we're the last to get it. Like, I just end up looking at a story today highlighting the first woman to go through a trial for the COVID-19. Is a white woman out of, I think in Seattle, if I remember correctly. But here's a couple things I wanted to highlight, because now they're giving the research for how fast this thing was. You know, remember how everybody was saying how this information, how did this vaccine get rolled out so fast? Like, now the information is always there. This is the reason. Let me make this clear. I always like to make this clear. The thing I love about science, when you take a scientific approach, the scientific approach gives you all the information. So unfortunately for the naysayers, for example, they'll just point out the negative and never give you all the information. But if you go research what's out there within the science world, you can see all sides of it. And so a lot of times I like to make clear that even though I'm an advocate, it's not that I'm just trusting what people are saying. You can go see the science. So for example, the speed of this is what I wanted to highlight on this video. So this clinical trial, this was the fastest ever. Prior to this, the mumps, which was an outlier, was one of the fastest vaccines that had come to market. And it was at 4 years. And even it was considered a outlier, right? And so when people are telling you that vaccines typically take decades to develop, that's true. Check it out. Why do you know that it takes decades to develop? Because science has it on record. It takes decades to develop, right? So what happened in this situation for why this could be so fast? Again, this research is just out. I just researched it, so I wanted to bring that to the table in addition to the fact that I'm in a vaccine trial. So what they broke down was the coronaviruses the cold is a form of coronavirus. If you want to get into the different, I guess, what you call it, families of viruses or whatever you might call it or whatever. But either way, so there was this outlook that there was going to be a need to develop a vaccine for typical, like different coronavirus or whatever. So the last example where they were almost about to start developing one, if y'all remember Zika, I don't know if it's, we've had these different ones, Ebola and all this kind of stuff, but if y'all remember the Zika one was actually a form of coronavirus or whatever. And it was this one scientist by the name of Graham, last name Graham, he had figured out some type of thing where he thought he could speed up developing a vaccine or whatever. And so his first attempt, he was about to start trying to run a trial during when the Zika outbreak happened. And he actually broke a record then. And I don't want to give y'all misinformation, but it took like 7 months to be able to get something to test. And then what ended up happening was the Zika breakout got under control. And so since they were able to stop it, then it stopped the development of that. But it was stopped the development of that particular coronavirus vaccine because they were able to stop Zika. So because it wasn't reaffected, no way to continue the trial and continue testing. And so the groundwork had been laid out years prior to the coronavirus due to saying, hey, this particular guy, and the reason, check out the history for why he was doing it. So there was this particular disease back in the 60s. It was an RVS. All I know is RVS. This would make sense to all the scientists, but I'm trying to give you all as much information as I can. So there was a particular disease that was attacking infants way back in the 60s, and they developed this one virus for RVS. I think it was some form of coronavirus or whatever, and developed it. And the trial, they put 31 infants through it. Right, this is the initial just trial for this vaccine. It didn't take, and like 16 of them still got the disease, and 2 died. Right, so for example, I'm giving you this example because for someone who's an anti-vaxxer, right, they would tell you that story and stop. That would be the end of the story to say, hey, vaccine, whatever, ineffective. and whatever. But the only reason I know it is because science gives you the whole record. And so, because it was ineffective, actually, matter of fact, it was more ineffective. Let me tell you what they told you. This is science. Just gives you the whole story. So that's what, so it ain't that we're trusting people. We're looking at the information that's available. So for that particular virus, this RVS, which is, they found out that because at the time, this is how they knew how to deliver viruses. So at that time, what they did was, I think it was smallpox. They had took a virus, a live virus, or smallpox, killed a virus, and that's what they input into the body. And it worked amazing for smallpox. Smallpox is, for understanding, the only eradicated virus in the world or whatever, completely eradicated, right? So at the time, based on what science was at, for this RVS thing that was affecting kids, they tried the exact same approach. Again, science wasn't as far as it is now. So what they did was they killed a virus, put it in the babies, or whatever, 'cause that's who was getting affected. Whatever, it's like 125,000 babies got affected with this particular thing or whatever. And so they tested it on 31 babies. Well, that worked for the smallpox virus, but what this particular vaccine did, it actually made them more capable of getting it. So they gave them the vaccine and they got it and whatever. But this particular Dr. Graham, I'm bringing it all back full circle now, he's been distraught about that happening. This dude is in his 60s or whatever now, right? And so he's always had it on his mind, in a sense, since that. They consider, in science, they consider that a failed virus, naturally. I mean, a failed vaccine, naturally. It made them more susceptible to it. Science put that on record. Well, this same Graham, 30 years later, had used computer sequencing to come up with a potential vaccine that only could be, at the time, tested via computers. Well, when the Zika came out, he thought he was going to get to put what he found on computer labs, science labs. He thought this might be my chance. They put some money up. They were developing it for Zika, and Zika stopped, so he never got to test it. But he broke a record at the time, 7 months. Well, when the coronavirus broke out, he basically said we might have again. This is his chance to put his stuff that's on the laptop. He want to put it in order because they were worried about a coronavirus could eventually jump from different species to humans. Like, this is just how a virus develops. So they're always looking and worried about this stuff. But this guy been studying this. So he has this thing, and basically, long story short, he basically breaks the record 66 days from the development of a vaccine and it getting put in the first person arm. I literally learned this because they were following the girl. Her name's Haler. She was the first woman to do it. Howler or Haler, however you say them. She was the guinea pig. She was the very first one. So white woman wasn't a black woman like you saw in the pictures. Again, all that was marketing because they're trying to get our community over our hesitancy. And so they broke the record, and basically they did how many people was it? I think it was 60 people for the very first one. Then they upped it to 600. Yeah, 600 for phase 2. And then phase 3 was 30,000. So this is what the current, this is the Moderna one. This is the phases that it went through. So at the end of the 30,000, this is the process. Again, it ain't the people that we trust, it's the scientific process. Now this is the Moderna one, is the one that was the sister developed. The sister actually developed, her name's Kizmikia Corbett. So she developed it or whatever. And so they do through the 60. The first trial was, 60 people. Next one was 600, and then 30,000. So when it gets through the 30,000 trial, check out what all they're saying. They're just testing for safety. That ain't even testing for how effective it is, because that's how science steps through it. And so let me read this to y'all just to share. So it says, because of so much earlier research led by Graham and Moderna, no one involved expected the vaccine to make the disease worse, which had happened with the RVS 30-something years ago. So they had enough research now where they felt safe that what they were doing this time around wasn't going to do what happened 31 years ago. It said, but still, side effects are common in vaccine trials, including pain at the injection site, which I had on mine, tiredness, which I had, headaches, no headaches for me, muscle pain, chills, joint pain, swollen lymph nodes, nausea, and vomiting, and fever. These are the expected side effects that could possibly happen from a new vaccine being brought. But it says if any serious side effects emerge that weren't expected, the trial would be immediately suspended, even halted for good. So this is the process. And again, I'm not telling you this process makes it safe. I'm just telling you that every step of the way, they have to approve these different steps before anything would ever be got brought to market. And when you follow and go look up the science and not just what they're saying in the media and competing with somebody who unfortunately may be obviously there's a label for, not saying that everybody that everybody who doesn't want to take the vaccine, I'm not saying that they're all anti-vaxxers. That's not what I'm saying. However, there are anti-vaxxers who do push information, either false misinformation or one-sided information. One-sided information only telling you the negative effects when you can actually go see the full studies, because like my good friend, brother Unc always says, you won't find an anti-vaxxer with a full study because they can't tell you the whole information because it goes against what they're pushing. Again, the anti-vaxxers are those who are intentionally pushing misinformation. They'll only tell you what bad came out of the research. Whereas here, I'm telling you the whole story. And again, even at 30,000, that was just only showing that it was safe. So the next phase of the trial was to go see if it was effective. And the last thing I'll tell you, like I always say, so even for them being able to speed up this vaccine being brought to market, the FDA hasn't lowered its standards. So these companies still will have to meet the exact same standard regardless of speed. So again, that's just understanding the science of it. So I just wanted to, break that down, point out that unfortunately for all of the misinformation of saying they trying to line black people up to get it first, we're probably going to be, in a sense, last in line due to some medical inequities. That's what's playing out in reality. So all that information of being feared, why they showing us first, the reality is showing the opposite. So that's some misinformation, they got, well, I can say misinformation that got pushed, but people just didn't understand what was behind the marketing. It was a sister that runs the AMA that was behind the marketing, trying to, in a sense, help get us over our vaccine hesitancy. I got one of my other friends who pointed this out yesterday, Tim Jackson, brother who's real thorough. He pointed out that the people that are most unlikely to take this, who has the highest level of vaccine hesitancy, are conservative white men or whatever, which is a very true point. And I know for him, he was like, well, stop pushing that black people have the highest. Demographically, blacks do, demographically as a whole, African Americans do right now show the highest level of vaccine hesitancy. But when you start narrowing out the demographics, the specific highest are white conservatives, due to all the misinformation that, let's keep it real, Fox News pushed. And I don't even like making it political, but I'm not surprised that is the group with the most vaccine hesitancy. But the reason I even bring up Fox News is because I pointed this out exactly when it happened. When they was pushing that misinformation, Rupert Murdoch, the owner of Fox News, was one of the first people in the country to get the vaccine. I'm like, he make all this money pushing misinformation and first in line to get the vaccine, because vaccines, of all the different conspiracies out there, I'm going to say this and keep it a buck with y'all. Of all the different conspiracies that exist, that have ever existed, I'll be honest, this is the one that makes the least amount of sense, because there's so much scientific information to back up this side of things. Science always tells you the whole story. Like, you can't get the Novavax vaccine that I'm getting right now unless you volunteer for a trial. Why? Because the process has to be tested and proven before they would dare bring it to market. And right now, part of the issues, some of the inequities that already play out are why we are, in a sense, generally speaking, last in line to be able to get this. But as I said before, I don't want to give any misinformation. Part of it was for all the money that was put up for the trials and the production, there wasn't a lot of money put up for the distribution of this thing. So what's happening is there even hospitals that are getting necessarily the first dosage they don't have it set up for the second dosage that has to take place on time in order for the vaccine to be effective. Like I even had one of my partners, one of my other partners tell me about his friend who got a vaccine luckily. And the reason he said luckily is because something had happened with the distribution to where, they were about to, because they have to be delivered on at such a low temperature, but they only have so many shelf life, or whatever, the current ones, whatever. So they were about to run out of shelf life, and basically somebody didn't show up to their appointment because of the misinformation, and because his wife is a doctor, they was able to call out to people and say, hey, we got these available vaccines, but we got to do them today because the shelf life is today. So that's the only reason he was able to get one. And then I even heard, he told me of another story where there was a traffic jam that delayed the vaccine getting to the actual place, and so the nurses and the care worker on the actual truck will basically let people volunteer for the vaccine on the spot just so that they wouldn't waste the vaccines. And so, there's a lot of information that's available if you go look at the scientific information. Last piece of information, I want to clear this up because I said this on the last video, and again, I just want to keep putting this out here. So, for example, there's obviously new strands, for example, new strands of the vaccines that are being created due to so many people getting affected, right? And so one of my friends was questioning when Dr. Fauci, for example, and I'm not saying follow Dr. Fauci. You can go find out specifically from the actual scientists and their work and, whatever. He's a mouthpiece somewhat for the government, but he's a scientist, so I'm not disrespecting Dr. Fauci. I'm just saying one of my friends pointed out how, for example, when Fauci said, how did he know that the current vaccine will work on the new strands? Well, when you go look up the science, there's a B117. There's a new strand here in the U.S. They've already done studies to show that the current vaccine is probably going to work just as effectively on that strand. But there's one in South Africa, B13. Oh God. I think it's 351 or whatever. I think it's B1 351. I might have the numbers mixed up. But my point being is that one seems to be more contagious and is even avoiding the antibodies that have been put out in the vaccine. So they're very concerned about how effective might the vaccine be against that strand. So an anti-vaxxer will just tell you about the strand that is not, that scientists, that's because here it is. Here's the funny thing. Anti-vaxxers have to go get that information from the scientists. They can't tell you the stuff negative about the vaccine because it's not like they got microscopes or got studies that they can go tell you the information they got. They have to get it from the very people that they're telling you not to trust. They're just giving you part of the information. They only give you the negative. So they would tell you, see, the scientists don't know what they're talking about because they don't work on the strand in South Africa. But the only reason I know it is because I looked up the information and the scientists are saying it works well on the new strand in America, but it don't work well. From this early study showed that it don't work well on that one. And so, and here's the big push. The big push, and again, this is just looking at what the different scientists said. So I'll give you one other example of how fast science is today. So for example, I'm getting some of this is coming back to my head from my studies. So for example, when the virus first showed up in China, they called it in China, the scientists called it the Wuhan market pneumonia. Like that was what they named it at the time or something like that. And so anyway, when the strand showed up, they basically put the genetic code of the virus up. And in 2020, the scientists, they have this one system they go to and they can see all the scientists around the world can see it because they got this one site they go to that's just for scientists. Like, so I'm just kind of saying, like, this is the information age that we live in, whereas 20 years ago, it would have been a long time before any other scientists in the world would have gotten the genetic sequencing code for the actual virus. But in 2020, it's the same day that the scientists in China discovered it and put it up on this site that Graham guy was telling you about. He was able to start going into action with this particular vaccine that Moderna brought to now a record to the first shot being put in a human's arm in 66 days. But he was able to start because he got the sequence in the same day the Chinese scientists put it up. And that's another thing that I'm constantly talking about in this day and age. Like there's vaccines being developed all over the world. Like Russia just developed one, and theirs is 91% effective, or whatever. The ones here in America are showing to be 95% effective on the current strands. As far as the B117, they'll still be doing testing on it, but it's looking like it's going to be effective on that strand as well. Here's the last thing I'll say. Again, I'm just like to give people as much information as I can about, again, just keeping abreast, because the immunization doctor that I brought on for the Zoom that we did last month, and a lot of people in the field tell me, literally, I get calls and texts, some saying that I appreciate just what you're doing, because I just like to give people the correct information. When I tell people with the $1 Million Community Club, we are, I call the callers our truth seekers, then for me, I feel obligated to give people as much correct information as I can, sincerely. It ain't, for me, it ain't about believing anybody. It's let me go see the evidence and the tests that show me what's going on. So I say all this to say, here are the biggest fears, and we're probably going to not beat this. But for the most part, the scientists are fully expecting, unfortunately, the coronavirus to become an endemic, meaning it's going to stay with us. That's pretty much what's lining up. We've had too many infections around the world, and they may eventually have to, just like they do with the flu, continue to develop new vaccines due to all the infections, because the vaccine currently right now is more or less, let me make another clear point that I made on another video. The vaccines that are out there now their efficacy is in order to keep you from getting the actual disease. So what happens is you get infected by a virus, right? And then if your body can't fight it off, you end up getting the disease. So the current vaccines that are approved, Moderna and Pfizer, emergency approved, their efficacy is ensuring that you don't actually get the disease. They're not tested to stop you from getting the actual infection. So that's still being developed. And so let me make that real clear. So if you wasn't getting the disease, for example, let's say we were already, if we were already vaccinated, you wouldn't have 400,000 deaths, because there would be people not actually getting the actual disease. So that's what the vaccines now protect you from. They haven't got a vaccine right now that's developed enough to ensure or test against getting the infections. So with that said, as people can still get infected, that's where you have more opportunity for mutations. So unfortunately, if we had been able to get out in front of this thing far enough, there was a possibility to end it like Zika ended, to end it like Ebola ended. Like Ebola, believe it or not, it didn't become a pandemic, but it took 3 years to end it in the 3 African countries that it had spread in. They were able to get it contained because it wasn't quite as infectious. It was way more dangerous. All right, so can you break down the numbers? What numbers you want me to break down, James? Which number specifically? I hope it's something I remember or know. I know I got a lot of numbers in my head, but I don't know which numbers you're asking me for right now. So which numbers? It says, yes, like the flu, you'll need a shot every year. They don't know that yet. Okay, why didn't we see 3 million deaths in the U.S.? Eventually, because we did attempt initially, because because we did it, the world ended up making an adjustment, right? So part of a lot of the paranoia around this thing is it's been 100 years since we seen a pandemic. So we in our lifetimes don't know nothing about this, but you can go back and see in 1918, believe it or not, wasn't as many people in the world as it is now, but they were different countries around the world were social distancing during the Spanish flu. Because what happens is science procedure, once there is a novel virus that hits, once they know and can say, oh yeah, this is a different virus, it's not one that we've seen before, then the very common practice in order to slow that virus is, all science has at that point, is social distancing. Like, that's all it has. The mask came into effect with coronavirus and the Spanish flu because they were airborne infections. whatever. But standard practice until science can study the virus and figure out what they might can do. In other words, develop a vaccine or antiviral for if you actually get the disease to remedy it, then the only option science has is to social distance. And so the reason we didn't see 3 million deaths, and right now only at 400, I mean, only that sounds pretty bad for 400,000, is because we did eventually, we should have did it sooner, but we eventually did do some social distancing. And then I think, be honest with you, part of the reason we got to 400,000 though is when we seen the initial dip that social distancing would create. Matter of fact, a sister I follow, Deetra White, is doing a whole campaign trying to just about the vaccine and our hesitancy. She had asked this question, why did we even go back to school now that we're at 500 deaths a day? Back when we initially started social distancing, we were nowhere near that number or whatever. Well, unfortunately, when we did do social distancing, which can be effective, they kind of shut us down and we were in the house. Remember that time period? The numbers went down. We came out of it too soon. So now since we came out of it too soon, the virus is so spread out now that even though social distancing is encouraged, there are too many infections in the country for it to be as effective as it was when the disease hadn't spread throughout the country. Again, I hope that makes sense, but just trying to break down the numbers. But yeah, we would have seen 3 million if we didn't do anything. Like, believe it or not, I mean, crazy as that may sound. Let me see what you said. Most people just don't think the isolation and shutting things down is worth it for something that only kills 1%. And then, they ignore the 20% that you mentioned. Absolutely. So they break that down. Right. Yeah, no doubt. Yeah, hardly nobody considers the collateral damage. You know what I'm saying? When you hear 1%, or death, what's that? That's not why are we doing all this for 1% of death without realizing that the collateral damage, for example, coronavirus. So 1% die, but for every one person that die, 3 people, the fighting of coronavirus invokes a stroke in them. So they don't die, but they have a stroke. So it's just like while their body's fighting the way that coronavirus attack their particular body, they end up having a stroke. But again, it's only happening because their body's fighting off corona. So it's not necessarily that corona causes the stroke, but their body's response to fighting off coronavirus causes a stroke. And then if you think about stroke recovery, some people recover fully, some people don't. So for those who don't, that ends up being a collateral damage of quality of life changing because your recovery from the stroke. You might recover from coronavirus just fine. You might get all your lung capacity back. But whatever recovery you got from the stroke, if that changes your quality of life thereafter, that ends up being a collateral damage of corona. But something that commonly happens is for every 1 death, there's 14 people that lung capacity never returns. Like I just talked to a friend, him and his wife both got it at the same time. This brother, for his exercise, he walks 7 to 9 miles a day. That's his routine exercising. Healthy dude, him and his wife, both healthy. He said he would not wish coronavirus on his ex-girlfriend. Like, because he said his headache. He said his headaches were like having a HBCU marching band in his head, and he said he has a set of stairs in his house. This dude that walked 7 to 9 miles a day when he was healthy during his routine while fighting coronavirus, he walks up the stairs and he said he's tired as all get out. Said he walking up 1 set of stairs. Said it was the worst thing him and his wife even went through. So so everybody's quality of life doesn't return. 80% recover, no hospital. He didn't go to the hospital. He even admitted part of his fear for going to the hospital is because it seems like, some people not coming out. So I get the fear. I'm not saying this as though, again, me jumping in this trial is not because I'm fearless or whatever the case may be, or acting like there are no side effects. Like even this, I'll even share this one piece of information. But an anti-vaxxer would share this to you to be like proof I ain't touching that virus. The biggest mistake is thinking that the vaccine, touching that vaccine, I'm saying it backwards. Just thinking that the vaccine is worse than the virus. That is the biggest mistake people are making. All right, let me see what I got else here. Yeah, of course. Yeah, of course. Yeah, exactly. 1% of the U.S. population is over 3 million. What people typically try to come back with, James, is everybody ain't going to get it. They may not all get it this year. But we're talking about, for the most part, who goes throughout their life and not having flu. And the coronavirus right now is headed in the direction of being an endemic, similar to the flu, with mutations significant enough for the vaccine not to be as effective. And again, I try to make very clear here, the vaccine right now is only for you not getting the disease. They don't have a vaccine right now that stops the infection. That's still being worked on. So I try to give people as much clear information. On the last thing I was going to say, anti-vaxxer would only tell you this, and this will be enough to scare you off. There's one death that's being studied right now to see if the vaccine actually caused it. Only reason I know that is because the science gives, they tell you everything. There's been some others that have assumed to be associated with it, like the Hank Aaron thing or whatever, not associated with it. Another doctor that the family is saying wasn't because they got the vaccine because he was healthy or whatever. But there is one death that is being studied. I gave you the example of 31 years ago where the two babies end up passing away from RSV, whatever type of virus that was, or whatever. Science documents it all. And the reason they end up making the decision to do it is because when the virus has killed 400,000, I'm not saying it's okay if somebody dies from the vaccine. I'm not saying that at all. But when the risk versus reward, or the risk highly outweighs bringing a vaccine to market versus allowing the virus to float, to just spread, then it becomes a very easy decision. And the reality is, for our community, this is going to be the most tested. It has been the most tested vaccine in history due to the money being put up to have the trial so large. Because it costs a lot of money to bring vaccines to the table. And they got a blank check. So the blank check absolutely aided to the speed of it. But I now know the history, as I told y'all earlier, for those who just getting on, that Dr. Graham or whatever, not doctor, but scientists, they had been working on this for years. And here's the last thing I'll say, and I'm definitely out this thing. Another reason they're concerned about it, the coronavirus is being with us. For example, the Zika virus went away years ago, or whatever. But coronavirus is carried in several animals, like bats, gorillas, and like 2 other species. And so what I was looking at, what they were saying within science, whereas the Zika virus was only affected humans, and so they were able to get rid of it. But because the coronavirus can attack and has attacked these other animals, because it's in so many species, it'll be hardly impossible to get eradicated completely, because just like it jumped, they're still trying to pinpoint exactly what animal it may have jumped. The theories are the bat, mace, or whatever, but science has not confirmed it specifically. They're still trying to narrow that down. But with that said, because coronavirus is in so many species, they don't anticipate ever necessarily being able to eradicate it like smallpox has been eradicated throughout the world. So these are just all the information that, again, is available if you go look at the scientists. You don't have to go listen to what the government says or what Dr. Fauci says. The information is out there. The scientists tell you the whole story, the good and the bad. I'm going to trust that over anybody that just gives me the good information or just gives me the bad information. You can see the whole story with science. I'm in my trial. I'm kicking it down. Me in this trial doesn't prove anything. I'm just one example. But just know that this vaccine has been tested. I hope I wasn't saying that backwards just now. I keep flip-flopping virus and vaccine. But this vaccine has been tested more than any other just due to the money being available. And I talked about how science shares this information on this one website. They couldn't do that in the past. So because of the sharing their information, everything is much faster and you can go see what they show in the test. All right, with that said, I'm gone. Again, just trying to give people the factual information. Last thing, for anybody that was keeping up with the game, the whole different subject. For anybody that was keeping up with what happened with GameStop over the last couple of weeks, today's show, GameStop, who won the GameStop Revolution, who won the have or have-nots. Amazing show. We had Jack Ponte and Michael Sutler on as our guests, along with guest co-host, personal finance coach Ashley Thomas. One of our best shows. It was almost a perfect show as far as giving people the game on exactly what happened. Everything you're hearing in the media about GameStop is incorrect. Go listen to the Mental Dialogue talk show on, you say, what's up with Tiny and T.I.? Oh, yeah, I know. That's a whole nother subject, man. I believe them. I believe them. I think this sister, unfortunately, is just spreading a bunch of bad information, man. I think she's kind of been proven to be spreading bad information with bad intentions, and even the one time that if it's true, the little bit I've been hearing, if it's true that T.I. may possibly did pull a gun on her or whatever, I know that part might actually be true or whatever, but she went seeking that situation out even after being told stay away from them. I think from a restraining order possibly. So yeah, that's just a big joke, man. And so, so the question there was, even if he did, and I'm not saying he did, but I'm just saying, why would you go create the situation and then go cry victim when you've already been told stay away from with a restraining order? And so in that situation, it might have been just, let's see. It says not pro or con just yet. Please review the current. Yeah, I do all the time, Lauren. I would do it all the time. I would just encourage you to make sure that when you see, because they're reported. Like right now, the injuries right now are coming out of about 11 to 1 mil per 1 million, Lauren. So 11 injuries per 1 million is where the numbers are kind of playing out right now. They did have that. They did have the one in. They shut down the immunizations in California. They, for example, that one batch in California. They shut down that batch in California. The epidemiologist for the state of California shut down that one batch because it was having higher side effects. So they are still studying what's going on with that one batch. But she said keep all the other immunizations going. So yeah, I study all that stuff all the time, Laura. But just in studying it, just make sure you're being, doing comparative analysis. And so, 11 and 1 million adverse effects, compared to, unfortunately, viruses kill 400,000. Again, the numbers just kind of play out. And I'll say historically, I'll share this with you as well, Lauren. Coronavirus aside, generally speaking, vaccines come in about 1 in 5,000 as far as vaccine injuries go. I'm talking about this is the general numbers prior to COVID, because these numbers are being studied, as it's happening real time. So, generally speaking, vaccine injuries are 1 in 5,000. Well, most infectious disease kill at 1 in 1,000. It's pretty typical that after enough people get infected or whatever, their mortality rate will fall at about 1%. Which is about 1 in 1,000. So vaccine injuries, not deaths, because vaccines rarely cause death. Vaccine injuries are 1 in 5,000. So just sharing the normal information prior to COVID existing, if you have something that may cause an injury at 1 in 5, well, injuries include rashes. Some could be severe side effects to minimum, but they're all counted. So injury could be 1 in 5,000 versus something that kills at 1 in 1,000. It becomes a no-brainer that the vaccine is probably better to have if something's killing at 1 in 1,000 and something causes a potential vaccine injury at 1 in 5,000. So I don't know if you're still watching, Lauren, but just so you know, I definitely look at all that. That's what I'll tell you. That's what I was saying from the beginning of the video, and I know you just jumped on, but the reason I love science is because you can see all the information. Like, science is not hiding what I just told you. I only know it because I was able to study it, because it's right there in front of you. You know what I mean? But if you are, in a sense, not saying you are, like you said, you're not pro or con if you're still watching, but ultimately the anti-vaxxers will only tell you about the injuries. You know what I mean? Or for example, they'll tell you about the vaccine courts that pay out for the injuries or whatever. So they'll share with you the overall number that they've paid out, but they won't tell you that's over the course of 10 years or the course of 12 years. They'll share the number just to say, look how much they've paid out, without recognizing exactly how many injuries that is, or what they won't ever tell you exactly how the vaccine courts work. They pretty much pay out. Like part of their payouts, believe it or not, let's say, for example, I'm in this Novavax trial, right? So let's say just to give this information. So I'm in this Novavax trial, and let's say I feel like I get injured, some type of injury, and I go to the Vax court and say, I want to plead my case that I've been injured by this vaccine. It's the only court case in the country where the government pays for me to bring the case to court. They pay for all my lawyers. Now, of course, they pay for everything for me to present all my medical evidence or whatever. And the reason they do that is because they took the liability out of the hands of the actual producers. Because when the autism case by that guy in Britain, I forget his name right now, when that came forward, that's when all the vax cases started. Prior to that guy that made the suggestion that the MMR virus was related to autism, nobody had ever even brought a vaccine case ever brought one forward. So they all span from that moment, and that's been debunked after now for 10 years. They've never been able to duplicate a study. And so if you understand how science works, if you peer review, your stuff has to be duplicated several times before it will be, considered something that's factual. And his study has never been duplicated. It's been attempted to be duplicated, but they couldn't duplicate it. So, that, and there's other things, they've studied it and it's been debunked or whatever. And so, that's just a short. Yeah, exactly. Well, I'll be honest with you, James. I don't consider him a nut from this standpoint, because I will admit that back when he first proposed it, I got scared of vaccines or whatever, because here's the reality. When he's first presenting that information at the time, and this is how anything that gets presented in science works. So when he's first presenting it without the peer review, you don't know if he's right or wrong. So I can vaguely remember when that was coming forward. And at the time, I used to be an anti-vaxxer. I didn't become one until, again, I still love scientific methodology. So until I could see it get debunked within the field itself, because what he did do, even though people was questioning exactly how he done it, and his history, is kind of shady. I'll keep that in mind. And he lost his license and all that kind of stuff. And, of course, that adds to the conspiracy for all the conspiracy theorists. But I will admit that until it was debunked, because what happened was, what he did do was prompt the studies. And so when the studies got done, they were able to debunk it. And, and the anti-vaxxers say, well, there's only been 3 or 4 studies. And I'm not disagreeing with that, because that came out when the anti-vaxxers won their case about a year and a half ago, for the Information Act, to see exactly how many studies had been done on it. And it ended up being like four studies or whatever. But of course, they painted the picture as, it ain't as many studies as they said it was, and we won our court case, and all they won was the case to be able to, the Information Act, to be able to see the studies. Like, they made it seem like they actually proved something, but they literally had moved a needle. They had moved a needle from, because they know the MMR had been debunked. And so now the lawsuit now is to prove that no vaccine causes autism. So that's completely moving the goalpost. Or whatever, but they make so much money pushing this misinformation that the people who, already are afraid. And again, I'm not even knocking people learning it that way, but unfortunately, they just give them a piece of the information. They don't give them all the information. They won't make it clear that all they won on that case was they took them to court for the Right for Information Act, whatever you call that act or whatever. But they made it seem like they proved that the government hasn't proven that vaccines don't cause autism or whatever. And so, again, it used to be the MMR specifically was what they brought forward. They moved the goalposts, and now they make it seem like the government hasn't proven it, and people send them money all the time to keep bringing these cases. They're making all kind of money off these people, man. I know, right? Oh, it's big money in misinformation. I mean, it's big money. The crazy part about this one is there's so much actual evidence and science to back this up. If you can make up another conspiracy theory like chemtrails, like make that one up, right? You make that one up, then, you know, you got free reign. You know what I'm saying? You got free reign. Because, you know, ain't no scientific studies to not prove chemtrails. They're fake from the beginning, right? So they're not making no, you know what I mean? Like, that's just a big joke. So science is not wasting time on that. You know what I'm saying? But when this, when this dude presented a study saying, hey, there's a link between something that they, vaccine, the science world does do, they had to go spend money to see if they could peer review and verify his findings, and they never could. So big difference. So if you make up a theory, make sure it ain't something that science is already doing. Do the chemtrails, do the 5G bullshit, anything. You know what I mean? Like, just do something that science is not doing. You know what I mean? Just see an outcome, work your way. This is how they do conspiracy. Go see an outcome, work your way backwards, and then tell the story forward. And then start putting it on the internet. And then, make sure you got your hit set up for all the hits you get. And you make all kind of money for people coming to your site. It's always been big money. People used to sell books and things like that. But now in the internet age, they can put together a whole conspiracy site. And, they get all the money for all the people that come to their site. Just like any other site. You can be doing a legit business. You want people to come to your site. You can do affiliate marketing and stuff like that. So all the conspiracy theory sites do that and make big money. So, yeah. Right? I guess it ain't too much work if you're making big money. It might be worth it. It gotta be. Because, at the end of the day, you had the government answering to misinformation. They used to wouldn't even address that stuff. So it's clearly big money in it, in an information age where now, people are, I think we talked about this on the last Zoom on Mental Dialogue. I don't know I forgot where we were talking about. I don't know if it was on Mental Dialogue or not. But with that said, I'm out. Stay tuned for a couple of events. We got a connections event in a couple of weeks. The Mental Dialogue via Zoom. That's going to be invite only. James, you will be invited. And just stay tuned for how you can get invited if you're not a Mental Dialogue member. If you want to become a member, go to mentaldialogue.com and become a member. All right. So I think it's only got a couple of y'all on here now. All right. I'll holler at y'all later.